When we talk about health IT, most of the conversations are usually focused around clinicians. Things like order entry, clinical documentation, med reconciliation, and all the systems and workflows that support the delivery of safe and effective patient care. But there's another group of people that are experiencing those same workflows every day, and that's the patients. Now, obviously, they're not logging into the EHR and documenting in progress notes or tracking their flow sheets, but they are experiencing the information that is put into those systems throughout their stay. Sometimes it's through a bedside whiteboard, sometimes it's through a printed summary, and sometimes it's just through the conversations that they're having with various clinicians throughout the day. So what I want to talk about today isn't really the patient-facing technology itself, it's all of the workflows and the data aspects that sit behind it. If you're new here, I'm Dre. I'm a health IT consultant who's been working in various roles in the field for the last couple decades, and I put out these videos hoping that it can help people to understand that broader picture. For many inpatients, one of the hardest things about being in the hospital isn't the treatment itself, it's trying to understand what exactly is going on. So of course, technology can't take away all that uncertainty, but it can certainly help if it's implemented in a thoughtful way, and there's workflows around it to help support those patient communications. So one of the simplest things that we can do for patients is help them to understand who it is that's actually looking after them. There's quite a few different ways that this can be accomplished. The method isn't really the important part. The key piece is you'll need to figure out where the information is going to come from and who's responsible for updating it. So are there nursing assignments that are already documented somewhere? If they are, can they be pulled in, or are nurses going to attach themselves to the patients as they come onto shift? Providers are typically attached in the attending and admitting roles, but if you have consultants who are also working on the patient, are they going to attach themselves to the patients? Is there a different way that that can happen? Can they be auto-attached with orders? Things like that. And if there's allied health that are involved in the patient's stay, are their names only showing up on the chart after they've completed documentation? Or is there some way that they've attached themselves to the patient prior to the patient being seen so that a communication can occur or something can be displayed to say you're going to go see this person and this is their name? When it comes right down to it, how the information is displayed to the patient isn't really the key part. It's that the information is available and that it's accurate. But from an IT perspective, regardless of how it's displayed and regardless of how you're leveraging technology to help you do that, you need to think about all the workflow pieces around it to make it so that the information could actually be provided to them in some manner. So once people figure out who's looking after them, the next thing that they're going to naturally ask is, what's happening to me today? For those of you that have spent time in the hospital, you know that there's a lot of waiting around. And if there is even a bit of information that can be provided as to what to expect and when to expect it, it can be very helpful in calming some of the nerves and anxiousness that patients feel. People aren't usually looking for an exact schedule. Healthcare is far too dynamic for that to occur. But it is helpful to know if a key event is going to happen, say this afternoon. Maybe they've got a CT scheduled. So if you're looking for a patient's plan, you'll want to start thinking about where does that information actually come from? Is it driven by orders? Is there a way I can easily see it? Is it a running clinical documentation that multiple people are going to work on? And is there even somewhere in half of these activities that clinicians can go to document that something is going to take place? The work behind it becomes very significant in order to support the conversations or to support those patient-facing apps, displaying what it is that the patients are looking to find out, and that's really what's happening to them day to day. You also need to think about, from a workflow perspective, what happens if things change. So if you are using an electronic tool and something shifts along the way, how is that communicated and what are the parameters around that from a workflow perspective? And again, not everything would have to be on that plan. It's not a minute by minute outlook as to how the day would flow. It is just some key things that you might want to think about from a workflow and a documentation and a general capability perspective being put together so that if someone asks, there's an easy place for you to go see it, or if there is an opportunity for technology to assist and it to go to a digital board or to a patient portal, that it is captured once in the appropriate time and place, and then it can be updated and kept accurate for the patient. If they have a better idea of who's looking after them and what kind of events they can expect, one of the other things that can be confusing for patients is to understand how all of the activities that are happening to them are related. Every single clinician that I've come across has been incredibly skilled at having those conversations with the patient to help them understand where they are in their journey. But there are some pieces that you may want to consider if you're thinking of taking some of those conversations and putting them in a digital facing tool. Things like what key pieces of the journey are being tracked already, how are they being tracked, where are they being tracked. If there is a summary report, perhaps that's displayed on a digital board, what would be included in that? What are those key milestones that are going to be helpful for the patient versus which ones need to have clinician conversations around them? The other piece that you want to think through when you're doing that, if you are looking to have a digital summary, a digital tool, or a printout that has key milestones captured, is what would the workflow be from a patient perspective? Should they have questions when they receive that information? Are they able to respond right in that tool with some of the questions that they have? Are they to track them on paper? Should they just be thinking of them when clinicians come to have conversations later? All the workflows around that kind of stuff are things that you want to think about as you introduce patient-facing tools that are going to improve the communication within the hospital space. So the last piece that I want to talk about where technology can really start to support this patient communication and patient knowledge growing is education. There's certainly always going to be a place for discharge teaching, but technology provides us with an opportunity to provide information throughout the patient's stay when it is directly connected to what's happening. So if someone is scheduled for surgery tomorrow, for example, there might be some educational material that's going to help them understand what they can expect today. If they're on a new medication, perhaps they can review some of the medication teaching sheets right when that medication is first ordered. And if you do have physical therapy or allied health services involved, perhaps there are some videos that they can watch to help them understand what types of activities they'll be going through before they have it so that they know what to expect. The opportunity isn't just about delivering the education, it's about delivering the education at a point when it makes a difference for that stay. It's also about keeping them engaged in all the activities that are happening throughout their stay by keeping them informed and having them learn about what's occurring. From a workflow perspective, it of course has some of the same conversational elements that we had with the other pieces. What is it that would trigger those education documents either to be delivered or to be printed out to be given to the patient? So is there certain documentation that triggers that? Are there orders that would trigger it? Is there just a general patient stay flow that would trigger things on day 1, day 2, that type of stuff? Do clinicians need to track whether the educational material was reviewed or only that it was provided? If there's questions around it, does that get tracked in a different way? There's a lot of different elements that need to be thought about. And as IT professionals, we often just jump straight to of course we can present this for someone, or yes, there's a digital tool that can do this. But really the workflow elements behind it are what's going to make it more meaningful and have it be presented in a way that is going to be optimal for both the clinical staff, the administrative staff, and the patients. Every organization is going to tackle this a little bit differently, and it does, of course, depend on some of the technology tools that you have in place. But it's not about how the information is being delivered, so it's not really the display mechanism or the tool that's being used to do it. It is all the pieces behind it that need to be figured out so that you can make sure that what is being displayed or what is being provided or what is being referenced when people are having those conversations is accurate, it's up to date, and it contains all the information you need it to contain. So this is a short one today, but I hope that it has been helpful in getting you to think about some of the workflow things that are sitting behind either patient-facing communication tools for inpatients or things that can support better conversations between clinicians and inpatients when we're looking at having them understand what's happening throughout their stay. I will see you again next time.